over 5 months ago, a deadly virus took over an unprepared world by a storm. As the world prepared for this growing emergency, a global scientific effort began to try to understand the nature of this new enemy. We may never know the exact origin of this pandemic. Scientists believe it began in central China as early as November 2019. Within weeks, it became out of control and was about to be unleashed to the rest of the world.
I liken this to a hurricane threat. And so whenever there's a hurricane threatening our shores, we have a meeting such as this, make sure that all our plans are up to speed. And so this is a different kind of a threat.
Now, first and foremost, there are still no cases of coronavirus in Florida.
In South Florida, Miami-Dade has its first positive coronavirus case. At least one of its workers tested positive for coronavirus as well. That employee worked at the store at 9420 Southwest 56th Street in Miami.
Good morning, JC and Eric. The city of Miami Beach is not only encouraging people to social distance, but is even going a step further by ordering people to stay at home unless it's absolutely necessary to go out.
Today, our city is going to be announcing the full closure as of March 18th of all restaurants, hotel dining rooms, bars, nightclubs, movie theaters, houses, auditoriums, playhouse, bowling alleys, arcades, gyms, and fitness studios.
Hi, Dr. Erich, how are you?
Good. Thank you for having me here.
Thank you for joining us. Brought you here tonight to talk about Miami's situation with the pandemic that's happening now. I know you've been one of my go-to people to ask questions and stuff when I thought I was having symptoms. So how are things in Miami going? You know, from it was almost 6 months now since it all happened from China to here.
Right. I think it's we have a well controlled for now. We're kind of like scared that or afraid that in the next couple of weeks or so, this number may increase. You know, especially that we may be opening a lot of we will be lifting a lot of the rules that we have in place right now. And we are afraid that some people that are not going to follow some of the rules that we have in place, such as the social distance, wearing the mask, and that could be an issue eventually, you know, when people start getting contagious, you know, with the disease, and then we will see the numbers rising in Miami-Dade. And we actually, we're getting ready for that. That's what we're expecting at this point.
I know that there's so many things online, you know, different stories and stuff like that. I know that I have a couple questions myself. If you have contracted and tested positive for the COVID, is it possible to have it, to get it again, or does it make you immune?
Well, Mel, this is a novel virus. We don't know much information about it, right?
Mhm.
However, in some areas of China, for example, in Korea, some people retested positive with the virus. Some of the patients that were already discharged from their facilities, and they were back into their hospital again with the virus. It's usually virus, when you have a virus, usually like any respiratory virus like SARS or any of those, you create immunity. But in this case, we do not know yet whether we are going to create immunity to this virus, or this is something that is going to be like the flu that comes back every season.
I was told by a local pharmacist that it's probable that if you've gotten the flu shot, that it can make it worse on you to get the coronavirus. Is that true?
That I haven't heard anything about it. Then it's two totally different viruses. The flu is one virus, and then the corona, which is the SARS-CoV-2. The disease is COVID-19. We doesn't have no relation that we know at this point with flu, with the flu virus, with influenza.
What is the difference between self isolation and quarantine? Is there a difference with that?
Yeah, definitely there's a difference. Isolation, that means that we identify that the patient has the disease, and then we isolate that person once it's already identified positive with the disease.
Okay.
Quarantine is more like what we're doing, most of us are doing right now, that we're staying home in order to avoid contracting, getting the disease out there. Or in some cases, we already have it, but we're still, in quarantine. We stayed at home. But that's the difference. Isolation is when you identify the person already, and you isolate the person in order to avoid transmitting the disease to others.
Is there an adequate amount of tests now available in Miami-Dade? Is that a problem at all for people to?
I don't think that we have enough testing. We are trying to put rules in place, on how are we going to test, the population. If patients come to us with symptoms, or the patients were in contact with a sick person with COVID, definitely, we're going to test a person. There's a priority on those, and also there's a priority for first responders, for healthcare providers, because we're trying to save the amount of healthcare providers available in case that the number of sick people rises in the next couple of weeks or so.
What is the normal procedure for someone to say, if I was to go to the ER and I was having, symptoms? What is the procedure as far as like getting someone back to get tested? How does that work?
Well, I recommend patients is that if you have any symptoms, if you have mild symptoms, a lot of the people they get in contact with the disease, with the virus, they have mild symptoms, like maybe fever, cough, shortness of breath. If there's something that you can handle at home, because basically at the hospital, we don't have a medication specific for COVID, we don't have a vaccine. Then if you have mild symptoms, we told you, please call your healthcare provider and, discuss that with them, and then let them make the final decision whether you're going to be sent to the emergency room or that's something that can be treated in your home, within your home setting. However, if you have symptoms that at the point where you're short of breath and it's really affecting you, the daily activities, then you definitely need to go to the emergency room and be tested. Because, something that we notice on this virus is that patients are developing DVT, which is a deep vein thrombosis. They're developing thrombus and they're going to the lungs. And that's something that those are the cases that they get complicated and they end on ventilators in the hospital, in the intensive care unit.
Oh, okay. All right. That makes sense. How is the situation as far as having enough medical supplies and ventilators and hospital beds? Is that still pretty scarce?
Well, Miami-Dade, for example, Miami-Dade is planning, in case that these numbers they rise, we are actually developing two field hospitals other than the hospitals that we already have. One is going to be in Miami, and another one is going to be at the Miami Beach Convention Center, where they're going to have 400 beds, and the one in Miami, 250 beds. A lot of the hospitals are redesigning the way they admit their patients. You know, they're creating units just for COVID patients. For example, in the hospital that I work, we have one unit just designated just totally to COVID patients. I know that some of the local hospitals are closing they're closing their pediatric floor, sending all the pediatrics to Miami children, and then, you know, in order to have more adult for COVID. The healthcare department is keeping in touch with a lot of the executives from the hospitals. They have daily calls where they work on the planning, you know, for the county. And that when it comes to supplies, that will be in regards to beds. In regards to supplies, definitely I think that at one point we're going to run out of some of the supplies, because you have to go from room to room, you have to change, you know, gowns, you have to change the mask, and but that is something that they're working on it. Hopefully, you know, we don't run out of masks and we don't run out of gowns, because I mean, that would be really, it would be a disaster for the healthcare personnel and for the patients. In regards to ventilators, we do have, I don't think that we have enough ventilators in the whole U.S. Mm-hmm. And Miami-Dade is not going to be the exception to the rule, you know. For example, in the United States, there's about 331 million, that's the population in the United States. If 45% of the population in the United States gets infected, and about 5 to 10% of the population needs ventilator, let's say those are the severe cases, we're talking about 7.5 million ventilators that we're going to need at one point. I believe what we have in the US is about 120,000 ventilators, the most. Wow. Then definitely we may run out of ventilator at one point. That's why it's so important that people follow the rules in order to avoid, you know, overwhelming the staff, overwhelming the hospitals. That is very important. The cooperation from the people.
What makes you guys decide whether to? I know I've had a couple friends in Miami that you know, they went to the hospital, went to the ER, trouble breathing, and they just didn't really give them a choice. It was like a ventilator right then, you know, and they put them in a medically induced coma. Like at what point does a patient have to be at to do that? Is it double pneumonia or?
No, I mean, COVID characterized for a pneumonia, a specific type of pneumonia, right? And once sometimes patients, they're tested negative, but when we do the CT scan, you know, it's a very typical, the way the film looks for a typical pneumonia, right? However, we treat the patients, all the patients the same, but some patients, they start developing, like I told you, the pulmonary embolism. And that's where even though we're treating them with anticoagulant therapy, some patients, they develop this, and then they start, their breathing, you know, start increasing, you know, they start having more issues, you know, with oxygen, you know, they retain more carbon dioxide, you know, which is the opposite of oxygen. And then at that point, the requirements of oxygen are higher, and we need to go, let's say, from having an nasal cannula to what we call a high flow machine, which is a higher concentration of oxygen. And in some cases, that's not enough. Then that's when you need the ventilator. Why? Because they get complicated. But it's not like the pneumonia is a double pneumonia. No, it's more because of the requirements of oxygens. They increase, and they're unable to breathe on their own. You know, otherwise, you know.
Whenever you put someone in a medically induced coma, is it true that you never get to like that REM state of sleep, and it's kind of like you can hear, you know, what's going on, or do you ever get to that, or do you ever get proper sleep whenever you're in a coma, if that makes sense?
Well, when you're in a coma, definitely you're at a stage where you don't have no control of any of the senses, right? However, a lot of I remember the elderlies and a lot of the people, they say, oh, the last thing that they lose is the hearing. And please don't talk around, I'm scared that they're gonna hear. That's something that, who knows? I mean, we don't know. I've never been in that situation,
Yeah.
But when you induce the coma, basically the person is without any sense. I mean, the person doesn't have no control.
And
You
a
can
friend of mine
with that person.
that was in Miami, she was saying, telling us about her hallucinations, which were intense. They're very scary, So I was looking.
Yeah, definitely. That's from the medications, the sedation that we use. Then some patients they hallucinate. It's a normal reaction from a lot of these sedation.
I know that when it first became bad in Miami, there were a lot of my friends that were kind of speculating whether or not PrEP was helpful with not getting this virus. Is there any truth to that you know of, or any studies?
You mean the PrEP?
Mm-hmm. The antiviral?
No. We don't have no. There's no study that I know that I'm aware that PrEP has any relation with the virus getting better, getting worse. No, I don't think that would be a. There's a lot of myths. There's a lot of things that people they hear. A lot of people like for example, they told people, no, drink zinc because zinc is good. Yeah, it's good. It's going to help your immune system, but it's not going to interfere with the virus. I mean, there was a study where they used zinc, but what they did is that they went into the cell of the virus and they inoculate the zinc. Yeah, at that moment it works, but when you take zinc by mouth, it doesn't go straight into the virus. And another thing that I heard was like drink hot tea with lemon every night. Things like that. No, that doesn't have no relation. The virus doesn't. I mean, it helps with the immune system.
Is it true that like the viral load with like some people could be carrying a stronger strand of the virus, and and because I know that some of my friends were really, really sick. We were all together, and at the same time. Some of us were not sick. Is that possible that the viral load is more with some people that are contagious than others?
Yes, that is true.
Okay.
That is true. For example, like I said, we have patients, they come to the hospital. They come with a typical symptom of fever, shortness of breath, cough, and some loss of the taste and the smell. However, and the CT scan and the X-ray, typical of COVID. You do the test and the test is negative. Why? Because it depends on the amount of the viral load that you have, and also depend on the stage where you are. If we test the patient at an early stage, maybe there's not enough viral, for us to determine, for the test to be positive. Then definitely that is true. The viral load makes a big difference, even for testing purposes.
So if it's within like the first 3 or 4 days, it's very possible that you would test negative, but in fact you have it. That's
correct?
Right?
I mean, and the incubation period is about 5 days.
Okay.
And the disease about 12 to 14 days. The worst days are the one between 10 and 14. Those are the worst days of the disease, but usually it's about 5 days for the incubation period. It's not like the flu, for example. The flu is like 1 to 2 days. You get infected today, by tomorrow you already had symptoms. And that is why we can, let's say when we treat the flu, we have the Tamiflu. We give the patient 5 days of Tamiflu, reduces the symptoms, and the patient gets better, right? With the problem with COVID is that there's a 5-day incubation period. That means that I get infected today, but not until like maybe 5 days later, I know that I had the disease. Then in the meantime, I'm walking around with the virus, and I'm contagious. And that's the problem with COVID, that we don't know when exactly this person got infected. Some other people are walking around and they don't have no symptoms, but they do have the virus. And those are the vectors, they're transmitting disease everywhere. That is why it's so important to wear the mask.
I see. What's the time frame from whenever you're tested to when you get the results? What is the wait time for that?
There are different tests. There's some tests that they're depending on the facility that you go. But there are some tests that within an hour we have the result, or even less than an hour. There are some tests that it takes about 2 days, and there are tests that they take about 7 to 8 days. At the beginning, we have only like 7 to 8 days, in order for us to get a result. Now it's taking less. However, what I said before, it depends a lot on the amount of virus that you have and the timing. The timing when we do the test. The fact that I maybe do a test today on you and it's negative, that doesn't mean that tomorrow, the day after, it could be positive. Because it depends on the stage where you are at the moment.
And like for myself, I still want to get tested eventually. Is if I had it in the past, will the antibodies, will they be able to tell that? If I would say it was like in March, if I had it then, will it still give a positive result? If I have no symptoms now, of course.
Right. Well, there's two types of tests. One test is to test for the disease. That means you have the disease right now. Mm-hmm. Or there's a test for antibodies. It takes about 1 to 4 weeks for the body, after you're in contact with the disease, after you have the disease, it takes about 1 to 4 weeks for your body to develop antibodies, right? That's a different test. That means in your case, let's say that you think that you had this 3 weeks ago, 4 weeks ago, and you just want to go and see, and you were not confirmed that you had it. Now you want to just know, hey, I have antibody or I had the disease. Okay, yeah, you can have an antibody test. However, I'm going to tell you something with the antibody test. It's more for you to know that you had it at one point, but the antibody test right now is not telling you whether you do have immunity, and we don't have no reference. There's 3 problems with the antibody test. One problem is that the quality of the test is really bad. I mean, there's about 12 in the market, about 2 or 3 of them, they're good, approved by the FDA. I believe the FDA was removing some tests the other day because of the quality. Also, there is a margin of error, which is about 5%. And also, we don't have, the main problem is that we don't have reference, because this is a novel virus. It's not like when you do the, let's say, the chicken pox. When you do an antibody for chicken pox, you already have reference. You know that at this level is going to be immunity. It's a good immunity, mild immunity, or you have immunity for life, right? We do not have those reference numbers. When you do an antibody test, it's going to give you a qualitative and a quantitative result. The qualitative is that yes or no. You have it, you don't have it. And then you have a quantitative result, which is a number. But the problem is that we don't know where to compare that number to. Then these antibody tests on the long run is going to be good for the government, or for any of the labs, to get to a conclusion, to develop a reference table. But for you, it will be only for you to know that, yes, I had the disease at one point, or I never had it.
Oh, okay. Have you seen a difference in the amount of positive test results with the Miami-Dade curfew that they have put in place now? Have you noticed a difference in the number declined in sick patients now that the city has kind of toughened up on everybody?
Yeah, the number declines, but like I said, we are getting ready because humans, we have different behaviors, and right now we're scared, we're afraid, we are staying home. However, they did a study the other day using cell phones that they noticed that people were traveling from place to place. People were actually, even that we're locked down or we're in quarantine, people were actually going around. Then imagine now when they open the doors, when we start going back to the hair salons, going to the gyms, having like a normal life, even that we're going to be wearing masks or keeping the social distance. Some people are they're gonna feel like it's okay. I can go back. I can do whatever. Maybe the washing of the hand is not gonna be as frequent as we're doing it now, and that's why we're getting ready to see that number increase, and not only here in other states also.
Do you feel like we should stay quarantined a little longer than? I know that Florida's going through phase one. We'll probably be like, Miami-Dade will probably be one of the last to start opening up, I'm sure. Do you feel like it's too soon for that?
Well, at one point we need to go back, to try to go back to our normal life. I mean, because then we're gonna have a lot of mental issues, anxiety, depression. I mean, and I feel that the way we're opening is depending on the penetration of the virus in any specific area, and depending on the amount of patients, of the sick patients, right? We know that our numbers are going down. Obviously, that's what we did curve, and that's what we actually did with this quarantine. But like I said, we feel that the number is going to rise again, and that's what we need to do as healthcare or as a patient, as anyone in the community, is continue, not maybe quarantine, stay home the whole time, because everybody has to go back to work. We need our normal life, but please stay. Keep practicing the prevention that we have in place right now. Washing your hands, keeping the social distance, wearing a mask. Try to avoid big groups, more than 10, 20, depending on whatever the government allows right now, the healthcare department. But if we keep practicing those habits, then we're probably most likely we're going to keep the number down. But not everybody follows the rules.
Yeah. Do you have any recommendations for those out there that are suffering, like the cabin fever, the mental, like going crazy from not being out and being able to be social? Is there any type of like daily regimen that they could do at home to like meditation or anything like that you recommend?
I was talking the other day with a coach, like a life coach, and this was exactly the same question I had, and I said, this is the moment for us to look into our life and see what I like the most. If what you like the most is to read, find books that you can continue reading. If what you like the most is to exercise, then find ways to exercise within the limitations that we have right now. Find a niche where you feel happy. I mean, the well-being is not only about the physical, it's also the emotional, it's also the way you eat, the way keeping in touch with your friends. This is the moment I think that we need to invest in ourselves and find the things that we really like. I know that sometimes it's easy to say, when you really need to provide the food for your family, or you're like the main provider for your home, and you don't have a job now, and there's no money coming from anywhere. But this is a moment to find what is what you like, or maybe to think about the plans that you want to set in the future, for you and your family. Something else is that this is the time to recognize those people that they're really important to you, and spend time with them. I mean, that's what I recommend. There's nothing else you can do. I mean, at this point, basically we're in our home. We don't have nothing to do. Just find what you really like and focus on that.
Mm-hmm. Well, thank you so much for taking the time to talk with me today. I appreciate it, and always answering my crazy questions.
I
appreciate it.
Thank you for having me, and please, anything I can do, anything that I can help, be very happy to do so.
Thank you. Thank you. Thank you so much.